Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Thank you so much for viewing today's episode of Dr. Ozello Sports Medicine Report. On today's episode of Dr. Ozello Sports Medicine Report, I'm going to cover cervical radiculopathy. Cervical radiculopathy is a common condition. Cervical radiculopathy is compression or irritation on one of the nerve roots in the cervical spine. The cervical spine is the medical terminology for the neck. The cervical spine contains 7 vertebrae and 8 cervical nerve roots. The nerve roots branch off in between the vertebrae and travel through a space called a neural foramen. When we start counting the cervical vertebrae, we start at the top. So C1 is up at the top, and then we work our way down to C8. C8 exits the spinal column in between the vertebrae C7 and T1. T1 is the first thoracic vertebrae. If you have the symptoms of a cervical radiculopathy, or if you have suffered an injury to the cervical spine, please see a medical professional. I am a doctor of chiropractic, but please, viewing this video does not take the place of seeing a medical professional. As a doctor of chiropractic, I have seen this condition in my office, so I do recommend that if you think you have this condition, see a doctor of chiropractic first. You want to get the proper evaluation, diagnosis, and treatment to set you on your path to recovery. So again, part of this disclaimer, please, if you think that you have symptoms of the cervical radiculopathy, or if you have suffered any type of injury to the cervical spine, please see a medical professional. The symptoms of a cervical radiculopathy are what we call radicular symptoms or radicular pain. Radicular pain is sharp shooting shock-like pain, or it can be numbness, tingling, or burning, what is called paresthesia, where it's an abnormal or altered sensation. Now, these symptoms, they may not be that sharp shooting shock-like pain all the time, but it can occur with certain motions. And in numbness and tingling, it may not be present all the time. It can vary in intensity. The location of the symptoms of a cervical radiculopathy depend on which nerve is being compressed or irritated. Obviously, if C1 is being compressed or irritated, the location of the symptoms is going to be different than if C6, C7, or C8 are irritated. The most common area, or the most common nerve that is compressed, is either C6 or C7, but any of these nerves can be compressed or irritated. The nerves go through a space called the neural foramen. Many times the irritation or compression on the nerve is caused by either a disc herniation, or it is caused by osteoarthritis of the cervical spine, what we call spondylosis. So there can be an osteoarthritis that is causing this irritation, or there can be a disc herniation. Either of those are things that can close down on the amount of space in the neural foramen and cause the impingement on the cervical nerve root. The cervical nerve roots branch off the spinal cord. They come down, they form a plexus called the brachial plexus, and then the brachial plexus has branches that go all the way down into the arm, hands, and fingers. Now, if there's an impingement on the nerve root right up here at the neck, it can cause those symptoms all the way down the arm. Like I mentioned before, it can be sharp shooting, shock-like pain, numbness, tingling, burning. There can also be pain up here at the cervical spine, or there can be pain along the entire pathway. Now, these symptoms, usually at the very beginning, they can be extremely intense, and they will stay intense if you do not get this taken care of. A cervical radiculopathy is a condition where there can be a large amount of pain, symptoms, and disability. There can be weakness in those muscles. If a nerve impingement is long-standing, there can be atrophy in the muscles that are innervated by the nerves. So you have to take action immediately. Please do not hesitate. If you have an injury to the cervical spine, or if you think you have a cervical radiculopathy, please see a doctor of chiropractic. Do not hesitate. As a doctor of chiropractic, I have seen this condition in my office before, so you want to seek professional care. I will do an evaluation. First of all, do a consultation as part of the evaluation, do an examination, and then I will give you the proper diagnosis. The proper diagnosis is so important because it sets you on the correct path to recovery. In chiropractic care, the main tool that I use is the restoration of the proper skeletal motion. It's called a chiropractic adjustment. Restoration of proper skeletal motion is going to help to optimize nerve flow along the entire course of the nerve. As a doctor of chiropractic, we will not only check the cervical spine, we'll check the entire chain, starting at the cervical spine, the upper thoracic spine, which is the medical terminology for the mid-back, check the shoulder, probably even check the clavicle, which is the medical name for the collarbone, and the entire upper extremity. You want to make sure that the entire chain is taken care of, because a nerve can not only be pinched in one place. Once it is compressed or irritated in one area, there can be what's called a double crush syndrome, where it gets compressed or irritated in another area, or there can be multiple areas of compression. So you want to make sure that you receive professional care. Do not hesitate to receive professional care. These types of injuries, when we talk about a nerve impingement condition, they do not heal on their own. You must take away the source of the symptoms, which is the compression or the irritation of the nerve. As a doctor of chiropractic, that is what we do. We restore proper skeletal motion, which is going to help to optimize nerve flow. Patient education is so important. I preach patient education in my office, in all the classes that I teach, in my spinal health classes, and in the chiropractic continuing education classes that I teach. I am always preaching patient education. And patient education is what this video is all about. I am a firm believer in injury prevention. You'll hear me say this in almost all of my videos where I talk about a condition that is preventable. Prevention, prevention, prevention. Injury prevention is easier, faster, and less expensive than injury rehabilitation. So use every tool that you have. Use as much knowledge as you can get about this condition to help to prevent this injury. Like I said, a disc herniation and osteoarthritis are the main causes of the impingement on this nerve. So you want to make sure that you do everything you can to keep your neck as strong as possible and to keep those muscles as pliable or flexible as possible. Keep the muscle tension to a minimum. So when you are working out, use proper technique. When you are playing sports, use proper technique. If you're playing a contact sport, say if you're playing football, please block and tackle with your shoulder. Do not use your head to hit. Please, sparing, it's crazy. All right, do not do that. That can lead to cervical radiculopathy. It can also lead to some other serious pathologies. So please use proper blocking and tackling technique when you are playing football. And in all other sports, please use proper technique and use good common sense. If you do get diagnosed with cervical radiculopathy, start your self-treatment immediately. You want to perform range of motion exercises through a pain-free range of motion. If you are doing an exercise and it is evoking or intensifying your symptoms, stop doing that exercise. But you can do range of motion exercises, even if you're just moving a half inch in each direction, it's going to help. You want to make sure that you are keeping the muscles healthy and that you are keeping basically the entire cervical spine healthy. Do everything that you can. Do range of motion exercises, do static stretches. Hold a mild, comfortable stretch. And just like I stated with the range of motion exercises, when you are doing static stretching exercises, you should never feel any pain or symptoms or an intensification of symptoms anywhere in the neck or in the entire upper extremity. So you want to be very mindful and listen to your body's signals. But you can do range of motion exercises through a pain-free range of motion, and you can do mild static stretches. Hold a mild, comfortable stretch. Once you have recovered, even more and you can do strengthening exercises, then you could start with some strengthening exercises. But that's going to be farther down the line when you have this condition. You can do nerve slide exercises for the brachial plexus or for any of the other nerves that are irritated. When doing nerve slide exercises are non-resistance, non-exertion motion exercises. When doing these exercises, the motion has to be precise. Nerve slide exercises are going to help to reduce impingement or compression among the nerves. So please, you can see some of my other videos. I have other videos on the brachial plexus nerve slides, but please do these exercises correctly and be very mindful of your symptoms. When I mentioned the range of motion exercises and the stretching, I said, please do not do any type of motion that evokes symptoms or intensifies symptoms. It's the same thing with the nerve slides. And then, as I mentioned before, the strengthening exercises. If you can do strengthening exercises for the upper back, the upper thoracic spine, that may help you. You want to do as much as you can. Please don't do any exercises that are irritating your neck. You can do exercises for the neck once you have recovered a little bit more and those muscles are able to move through a greater range of motion. But the strength exercise is going to be a little bit later on down the line. But it just all depends on the severity of your condition. Each case is a little bit different, so I can't put a date on there and say, oh, after this many weeks you could do strengthening exercises, because everybody's a little bit different in all the injuries, but especially when there is a nerve impingement condition like the cervical radiculopathy. So please use common sense. If an exercise does not feel right, if it's evoking symptoms or it's intensifying symptoms, the symptoms can be in the neck, they can be anywhere along the spine. If they're in the shoulder, down into the arms, doesn't matter if it's numbness, tingling, burning, sharp shooting, shock-like pain, just weakness, please do not do that motion or that exercise. But there is still plenty that you can do. Work through a pain-free range of motion, and that range of motion will gradually increase. And then you don't want to do too much. Start at your current level and slowly, very gradually intensify what you're doing. But start at your current level. Do not push into pain, do not push into symptoms, and do not push yourself too hard. Start your recovery at your current fitness level, increase the intensity in gradual increments, and you will start to see recovery results. Thank you, everyone, for viewing today's episode of Dr. Ozello's Sports Medicine Report. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Please feel free to visit my website, championshipchiropractic.com, where you can get additional information on the book, and you can also connect with me on other social media platforms. Please give me a thumbs up if you like this video. Also, if you have questions, suggestions, or feedback, please leave that in the comment section, and I will try to get back to you as soon as I possibly can. Please subscribe to my YouTube page, Dr. Donald A Ozello DC. I have 2 weekly shows, 2 Minutes of Anatomy and Dr. Ozello's Sports Medicine Report. Again, thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report, where I covered cervical radiculopathy. Cervical radiculopathy, just like all other nerve impingement conditions, can be extremely painful, can be extremely debilitating, and extremely frustrating. So please educate yourself. Watch this video. If you have questions, please ask me. I will do everything I can to answer your questions. Develop as much knowledge as you can on this condition. Do everything you can to prevent this injury, and do everything you can to recover from a cervical radiculopathy. Again, thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report, and please remember, train hard, train smart, utilize nutritional strategies that work for you, stay injury-free, and accomplish your goals.